introduction. And hello to everyone. So especially Patrick, Rashmi, and Rungsima. So let me just give you, okay. Do you see the screen?
Yes.
Okay, so I'll be talking about what other bleaching agents are available. So particularly here in Southeast Asia, in the Philippines, because of the effects of untoward effects of long-term use of hydroquinone, we have to look beyond to be able to see what else can we use for this very long-term kind of cutaneous condition that we know as melasma. So these are the two private teaching hospitals that I work at. So I'd like to acknowledge Dr. Evangeline Handog. She actually gave the information, most of the information for this lecture. And she had this book published in 2017, and I highly recommend it. It's called Melasma in Vitiligo and Brown Skin.
So first of all, good evening, everyone. And let me wish all my friends a very happy new year. I hope it's going to be a healthier year. And I'd really like to thank Dr. Patrick HUANG as well as Dr. Professor Go. You know, I really admire him for giving me this opportunity to learn from all my dear colleagues, Dr. Krisinda, Dr. Rungsima, about beyond hydroquinone. I think it's a very pertinent question. So we'll be talking about it today. So let's have a look. Already Krisinda has given us a very good introduction. There's a bit of an overlap. So I'm straight away going to the therapeutic options that we have, you know. They're very much similar in Asia, but as I said, for melasma, you have the topical sunscreens, which are broad spectrum and definitely with an inorganic sunscreen, whether it's titanium dioxide, whether it is zinc oxide or iron oxide, because you have to cover UVA, UVB, and visible light.
How he make very good use of lasering to manage patient with the demand of the bleaching. Thank you, Rungsima.
Hi. So just so you know, like I'm not very good at topical anyway. That is why you invite Chrissy to go over everything. Yeah, and you know, when we're talking about melasma, I think everyone used to hear me say, like, you know, anybody who find a way to cure melasma really deserve a Nobel Prize, because it's very difficult. It's, you know, anything can lightening the skin, but how would you keep it as it is? You know, that it takes a lot of effort. It's not only you need to do procedures, but you need to also, like, you know, keep doing something. At least you need to advise your patient to just regular sunscreen and you know, staying away for anything that can aggravate melasma as well.
Okay. So I think the time, we run out of our time, and thank you so much for everyone. And so the Chinese New Year is coming. So let's say, just like Rungsima, we say Happy Chinese New Year to everyone attending this conference. Yes, and I look forward to your attendance. And our next webinar will be the nail surgery. Will be chaired and by Chrissy, Dr. DIM-JAMORA will be our next activity moderator and the chair. And thank you so much for joining us. And thank you, everyone. Thank you.
Thank you very much.
It was a real pleasure
interacting
here.
Bye-bye.
It was a real pleasure. Yeah.
Thank you. Thank you.
Bye.
Bye.
Thanks a lot.
Thank you.
Bye.